So I'm a personal injury lawyer, and as a personal injury lawyer, I have the fun task of, at least on a weekly or bi-monthly basis, spending a good amount of time reviewing my clients' medical bills and their medical records. One thing that I know from my experience practicing over 11 years is that hospitals don't charge the same rate for the same procedure. They use a charge master. They could even use, if they're like a government entity, they could use literally an ordinance that says what everything's going to cost. And San Francisco, for example, says everything at Zuckerberg San Francisco General Hospital is reasonable in its amount, and all reasonable fees and charges related to the services at that hospital run by the county must be paid in full. Now, they charge a lot more at ZSFGH than they do at Kaiser, and the reason for that is that they treat everybody. EMTALA requires they treat everybody. So every time there's somebody who's homeless who gets brought in, or somebody who just doesn't have insurance, they have to get paid. And they don't get paid from those patients. They potentially could get them on Medi-Cal, and even if somebody doesn't have Medi-Cal, which is the California Medicaid service, they could get them enrolled. They have a health advocate there. They apply. There can be some retroactive coverage that treats them, but that doesn't mean that the patient gets any money. It just means they don't get a bill. The state of California reimburses them, or they get reimbursed through, the Medi-Cal for the county. San Francisco Health Plan is what it's called. So anyway, but for everybody else, including people who are getting SF General's treatment paid through their health insurance, whether it be Kaiser, United Healthcare, or anything else, they pay way, way more for that treatment. So you pay more.
And what do you think is going to happen when the Medicaid stops because they decided that they need to cut it? Who's not going to get paid now? The hospitals. So how are they going to get paid? I'm going to charge you more. Your health insurance is going to be more. Everything you owe is going to be more expensive because of them.